Welcome to the 2021 Infection Prevention Skills Fair presentation. Over the next few slides, we'll touch on some of the most important aspects of infection prevention to keep our staff and our patients safe. Hand hygiene is the single most important infection prevention measure because it can be accomplished by all employee types, that affects all patient types, and it prevents all infection types. Now, this can be accomplished by soap and water or by hand sanitizer, with the exception of C. diff. Please continue to use soap and water for all C. diff patients. Hand hygiene monitoring is accomplished by secret shoppers that perform observations and submit that data to Infection Prevention Monthly. So important times to remember when to wash your hands or when to sanitize your hands includes whenever you enter a room, whenever you exit a room, anytime before performing a task like a Foley catheter insertion or a central line dressing change, and every time you remove dirty PPE, including dirty gloves. We do stock a variety of patient bathing and cleansing wipes, and they each have their unique purpose. Purple Bag Ready Bath is for general patient cleansing. It doesn't leave a residue, and it doesn't have any type of chlorhexidine involved in it. The green Ready Cleanse wipes are for perineal and Foley care. The blue Remedy wipes is a barrier cloth, so that is a skin protectant, commonly used after bowel movements. The red CHG Sage cloth includes chlorhexidine, so this is an antibacterial wipe. It's commonly used in pre-op patients and some specific patient populations like critical care, or maybe some patients with specific devices, depending on the facility. Whenever you do use the Sage CHG wipes, you do want to make sure that that's documented under bath cleanser, antibacterial. The next few slides, we'll go ahead and talk about isolation precautions. Okay, so standard precautions is what we use for all patients. And it's dependent on the patient condition. Do they have a large draining wound? Or depending on what task we're going to perform. So an example would be if I'm going to suction a patient with a trach, I'm always going to at least be wearing, gloves and a mask. If I'm going to do any type of blood draw or IV access, I'm always going to be wearing gloves. And that's because during that task, the risk for encountering that patient's blood is high enough to warrant wearing gloves. So the gist is that with standard precautions, if you think you could be contaminated, depending on what you're doing, then just go ahead and don that type of PPE that you're going to need. Now, expanded precautions include airborne precautions, which is commonly used for TB, chickenpox, some types of shingles, and that would be for full body rash shingles or shingles in a immunocompromised patient. And of course, for certain COVID-19 patients, depending on what their treatment and clinical course is for that patient. It includes a negative pressure room, N95, and of course, if that patient needs to leave the room for any reason, we're going to make sure that patient has a regular surgical mask on before leaving that room. For TB patients in airborne isolation, they can be removed from that isolation once we have 3 negative AFB smears, or we have 2 negative TB PCR results. Contact precautions can be used for your resistant organisms like resistant Acinetobacter or CRE, and also C. diff. But for C. diff, we're going to use this orange contact precaution sign because we want to distinguish that, because like in the previous slide we mentioned, we want to use soap and water. So for employees going in that aren't sure what the patient's on precautions for, we at least want them to know to use soap and water. And for our EVS employees to use a bleach chemical to disinfect that room, especially after transfer and after discharge. So it's important to leave these signs up on the door until after that room's been turned over. That's how they know what chemical to use to turn over that room. For droplet precautions, this was most commonly for flu. But of course, COVID-19, all COVID-19 patients that are still contagious are going to be at least on droplet and contact precautions. And so this means that we want to wear eye protection and a surgical mask whenever we enter that room. And just like in airborne precautions, when that patient has to leave the room for test or discharge, that patient needs to have a surgical mask on as well for source control. Protective environment precautions used to be known as neutropenic precautions, but this is for our immunocompromised patients. So we don't want any type of live plants, especially plants that include dirt, and we don't want to have any sick visitors going, and use very, very strict hand washing for these patients. So, the concept is, what normally wouldn't cause us problems, like fresh plants and dirt and things like that will cause significant problems for these patients. For environmental cleaning guides, a good quick reference can be found right on the internet under policies, environmental cleaning guides, and each facility has a specific one. This is a good reference if you're ever unsure about what equipment needs to be cleaned and who's responsible and how often it should be cleaned. This is a good quick reference that will help you if you ever have those questions. And here are infection preventionists that are available to y'all at each facility. And so please feel free to contact these employees at any time. The goal is to not only keep our patients safe, but also to keep our staff safe. And that's by helping with any type of PPE or isolation questions that you might have. So if you have any questions, just feel free to reach out to any of these people at any time. Thank you.